Senator Hassan.
Well, thanks, Mr. Chair, and good morning to our witnesses. Thank you for being here and for your engagement on these issues. I want to start with a question to you, Dr. Gaffney. Patients across the country continue to pay ridiculously high prices for prescription drugs. Democrats passed the Inflation Reduction Act in 2022, which gave Medicare the ability to negotiate drug prices for the first time. Thanks to the first round of negotiations, seniors will see lower out-of-pocket prices for 10 drugs beginning in 2026, including medications that treat common conditions like high blood pressure, diabetes, and heart disease. Congressional Republicans opposed the Inflation Reduction Act in 2022 and are now working to undermine the negotiation program, starting with their move to exempt certain drugs from negotiation as part of the Republican budget bill that just passed. This will make some drugs, such as cancer drugs, more expensive for seniors in the coming years. Doctor, what will the impact be on seniors with cancer if their drugs become more expensive as a result of the Republican budget bill?
It's not rocket science. When the price of drugs goes high, when it hits people's pocketbooks, they go without them. I could, cite innumerable studies showing that. And what happens is people sometimes die. In fact, there was a recent study that showed that even relatively low copays cause people to go without their medications. That there will be harms to their health.
Yeah. Thank you for that. Dr. Miller, one concerning trend that drives up patient costs is the practice of, and something I think Senator Cassidy has already talked about this morning, it's the practice where providers charge patients hundreds of dollars in extra hospital facility fees or room fees at outpatient facilities. For example, one of my constituents had a regular appointment with a urologist. The appointment was covered by my constituent's insurance, but he was then charged an additional and separate $1,000 room fee by the hospital that owned the practice. So he goes and sees his urologist. The visit's covered, but all of a sudden he gets a $1,000 bill. Can you speak about the recent growth in facility fee billing practices and the overall impact on patients when they can't afford their care?
The impact is terrible because patients don't know. So how are you supposed to know that that you're visiting one of the thousands of clinics that has a facility fee and is located more than 250 yards from the hospital and less than 35 miles and was acquired before, I think it's November 2nd, 2015. So there's zero transparency. And so as a patient, when you go and see one of those sites, see a doctor at one of those sites, you essentially are paying 60, 70% more with no added clinical value and no economic knowledge that you are incurring that cost. So It is terrible for patients.
Well, I appreciate the clarity there. Several states have banned facility fees for office visits and telehealth, and Senator Cassidy and I have been working on this issue together, and I hope the whole committee will be engaged in it. Dr. Gaffney, as you know, the Republican budget bill cut more than $1 trillion from Medicaid and the Affordable Care Act, kicking millions of Americans off of their coverage in the coming years. How will these cuts impact health care costs for all Americans, including Americans who are covered by group or employer insurance?
There's going to be a multitude of effects. I mean, the premiums for people with ACA marketplace plans are expected to surge in the coming year. Healthcare prescription drug prices will increase for many low-income seniors with Medicare as a result of the bill. For patients who become uninsured, healthcare costs are going to soar because they're going to be hit with the full freight of the hospital bill. And finally, we have to incorporate the health impacts here, not only talk about dollars and cents. Right. I'm expecting to see more patients with life-threatening complications of common chronic conditions because they didn't get the care they need, and that costs something, but it also is far worse when someone dies as a result.
Yeah, I appreciate that, and I will follow up with just one other area of concern because I've heard about it from the head of the American Academy of Pediatrics or the American Pediatrics Association. For those types of care like pediatrics, which are covered a lot by Medicaid, a good portion of that pediatric population, without Medicaid dollars to support those patients, there's a real possibility not only of the maternal health deserts that we already have in this country, but of pediatric health deserts. Have you done any work on that?
I have not done research myself on that, but the reality is we know that these cuts could be devastating for the safety net providers, both in rural areas and suburban and urban, that take care of predominantly working class, low-income people. Look, these providers get a lot of their revenue that they use to take care of patients from Medicaid. So what happens when Medicaid gets cut by $1 trillion? I think we can all do the math.
Yeah.
Either they're going to cut services, cut staff, or close. It's not rocket science.
I appreciate that, even though it is a very stark picture. Thanks, Mr. Chair.